You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people with a bacterial infection, gum disease in their mouth. According to my first guest, she says no more bleeding gums, bad breath, loose teeth, painful teeth, red puffy gums. With the new technique and new technology, you could reverse it. And with us we have Dr. Alina Krivitsky. Dr. Krivitsky, welcome to the program.
Thank you so much, Randy. It's a pleasure to be here.
Now, I've had you on the program talking about some other topics. Your husband on the show talking about dental implants.
Sure.
So as a periodontist, who's the typical patient that comes to you to treat their gum disease?
Sure, Randy. We have several types of patients. We have primarily patients that come in because their general dentist referred them to us because they've been treating them for years and years and they've lost control and they can no longer help them. They've been doing deep cleaning after deep cleaning and their pockets or bone loss is continuing to increase and they're sending them to us to help them with their situation.
Could you tell me about that deep cleaning for a moment? So if somebody is getting a deep cleaning, that's a cleaning that's under the gum line? Is that what it's designed for?
Absolutely. A deep cleaning is a layman's term to go ahead and go underneath the gum line, especially for patients who are gum disease patients, because that distance for the gum disease patients in the what we call pockets is basically the distance between the gum and the tooth. And as the teeth disattach from the bone and gums, basically this distance becomes longer and longer, becoming more difficult to clean.
So the gums kind of move away from the teeth.
Absolutely, as the bone goes away as well. So the support system, because we periodontists are basically supporters. We treat the supporting system of the tooth. No matter how beautiful the tooth looks, if there is no great support or foundation, the tooth is not going to stay long in the mouth.
Okay, could you help me? Give us a working definition. Like what's an easy way for all of us to understand? What is gum disease?
So gum disease is actually an infectious disease, which is a very not so much well-known fact to most people. A lot of my patients that come in and talk to me about it, before I even get to say hello, they tell me, I know, it's genetic, there's nothing I can do about it. That's the first thing I hear from about 75% of my patients. Yeah.
Is that true or not true?
That's not true. There is definitely genetics that is important for everything in our life, but unfortunately gum disease is not only genetically predisposed, but it's based on infection.
So it's a reversible
bacteria. Yes.
Thing that you can reverse.
Absolutely. We unfortunately cannot bring back what's been lost already, but we can stop the process of it and we can eliminate the infection.
What are the symptoms? Somebody watching this, maybe they haven't been to the dentist in 5 or 10 years.
Sure.
What are the obvious symptoms that you may have this bacterial infection?
Well, the most obvious symptom is bleeding gums. Patients who are brushing their teeth or flossing their teeth, and there's always blood when they're spitting out.
But a little bit of blood when you're flossing, is that normal or okay?
No, blood is not normal. I mean, there's very little here and there where you've been doing aggressive flossing, sure. But if we're talking about daily bleeding and you're seeing, when you're spitting your toothpaste out, you're seeing blood or something
you have an
pink
infection.
or red, you have an infected gum, yeah.
Okay. Which will lead to what? Tooth loss?
Which will unfortunately eventually lead to tooth loss. And this is part of our practice as well. Part of our practice of patients who don't want dentures, don't want to lose their teeth, but sometimes it's too late. And we have to provide them with alternative treatments such as dental implants.
Okay, so bleeding is one of the symptoms. What's another?
So bleeding gums, malodor, bad smell coming from the mouth, spaces between the teeth.
Tell me about the bad breath. Yeah. So how could a bacterial infection have anything to do with the bad breath?
It's a very common question that I get from a lot of patients. A lot of patients will come in and say, like, somebody told me that I just don't have great smell from my mouth. Why is this? And the reason for that is, again, bacteria produces gases. They're called sulfur volatile compounds that are basically not so great in smell.
Okay.
And these compounds, when they become really hard to clean out the bacteria, they're just constantly producing this bad smell.
Interesting.
Another symptom is spacing that is occurring with time between teeth. Some patients did not have those spaces before, and all of a sudden they're starting to see black spaces between their teeth. Their teeth are flaring out. Now,
they're moving.
Right.
Okay.
Because there's no support system. That great support system we talked about is basically going away.
How? So the bacterial infection is doing what?
So the bacterial infection causes our body to have inflammation around it. So our bodies are amazing in trying to get rid of this bacteria.
Okay.
But what it also does in terms of how it deals with this bacteria is it removes all the infected bone around it, wherever the bacteria is sitting.
Okay.
So this way you're losing bone, and then of course to follow is the gum tissue.
So the bone kind of holds the tooth.
Absolutely.
So that's why they start moving, is what's created the space.
Teeth start moving, they're starting to look longer or not so symmetrical, and they're starting to get black spaces between the teeth where the gums start to move away. And these spaces cause a lot of inconvenience to patients because there's food that gets stuck in there. So everything I'm talking about, the red puffy gums, bad smell, flaring teeth, spaces, all of this we can actually treat now. We can help patients stop the process and basically for most of these symptoms to go away.
Now, long in the tooth, how does that have to do with the gum disease?
So lengthened tooth is basically based on the bone loss that occurs in response to the bacterial infection. And of course, with that, the gums go away as well, making the tooth look more yellow and longer.
But is the tooth actually getting longer? I mean, is your body kind of forcing it out of the mouth?
It can happen with very advanced stages of gum disease. However, most likely what's happening is the gums are receding back, exposing the natural tooth that is not so great looking because it's not meant to be on the outside. It's meant to be supported by bone and gums.
Okay, but the puffy red gums, we didn't go into detail on that. What's happening there? I mean, that's an obvious one.
So red puffy gums are basically a response to inflammation response to bacterial infection. So there is blood flow that is going into the area where our body is trying to bring all the cells to try to get rid of the bacteria.
Okay.
And this is a normal inflammation process causing lots of bleeding or puffiness to occur, as well as sensitivity during brushing and flossing.
Is this true, the number one way people lose their teeth? I think either you told me, your husband told me, like 40 million people have an upper lower denture. Is gum disease, this bacterial infection, the number one way people lose teeth?
This is a number one way a number one tooth loss reason all over the world.
So brushing and flossing it out is not going to work.
Unfortunately, when the pockets get deep enough, when they're so deep where the patient cannot get in there with a floss or a toothbrush, or hygienist cannot get in there to clean it, it is no longer possible to save the tooth.
Okay, so you say this is one of the busiest procedures that keeps periodontists busy. And there's like several ways to do it. And you do it very differently than most. Is that fair to say?
It is definitely fair to say.
And do you think it's more effective than how it's currently being done?
I think so, and I will definitely be happy to share the reasons why. I was taught traditionally to the USC School of Dentistry, where I got amazing training as a periodontist, where the only way to deal with gum disease was to really resect, to cut things away.
To cut it out.
To cut it out.
Okay.
And it's really, I mean, I'm sorry to say this, but this is the only way I can really give an analogy. It's kind of to amputate. It's kind of like, let's say you had an infection in your hand or in your leg. The first treatment would be cut it off. So this is kind of where, unfortunately, we're still dealing with gum disease on a daily basis all over.
So this is how it's currently being done? I mean, this is like the most popular way?
This is the way. There are hundreds being done in just the city where I live, Los
Like
Angeles.
hundreds every day?
Every single day by all my colleagues, periodontists, and that's how we used to do it.
You know, after we talked on the phone, it was pretty interesting. Like cutting out an infection, cutting it out, a microscopic infection sounds ridiculous in a way.
Correct.
Do you think of it that way? Like this is
So-
old-fashioned?
Think about it, Randy. I mean, in medicine, we're doing this. Imagine if every single problem we had to cut off a body part. I mean, this is really exactly the same
Is that
thing.
an overstatement, though? You're cutting it out? Are they they're shaving off part of the gums?
We're cutting out the gums and the bone that is infected with this bacteria, shrinking it down, which means the tooth gets longer by surgery and makes it more sensitive for the patient, more difficult to clean. So whatever gum disease would create over time, we're helping for that process to happen faster. So not many patients are able to maintain this.
But does it work? I mean, if it works, it works. Or do they have to? Or does it always come back?
And it does work for short period of time. I mean, I've been practicing long enough to tell you that most of these patients come back and they're just not able to maintain it. They either need the procedure again, or they're just so scared from any kind of dental experience. They will say, I'd rather not go because I was better off before than after the procedure.
Okay, with gum disease, this bacterial infection, what about lasers? Hot topic. We've had people on the program talk about it. Sounds great to me.
Lasers are amazing, but I guess I would say the problem that I have is that laser is not a fix-it-all solution. It's a great tool. It's a great tool that uses light to pick up some of these bacteria that have specific lighting, to go ahead and kill them. But laser doesn't go all the way down into deeper pockets. Laser is very difficult to control. There are different types of laser that most practices cannot afford to have few different types to treat the gums versus the bone versus the tooth. And laser, again, is a tool that is used in conjunction as an adjunct to other procedures. It's not used alone.
So what are you doing then?
So what we do is a little bit of a non-surgical approach. I guess it's my background as a dental hygienist, a non-surgical periodontist that comes in where, I saw from early on, from 18 years old when I became a dental hygienist, that we can treat certain things non-surgically. Surgery is not always the answer to everything. It can be, however, in this particular case, we're able to help patients with absolutely no discomfort, no pain, no surgery, and give them the ability to get to the root of the problem, the cause of it, as well as teach them to maintain it on a daily basis alone, themselves at home, so they're not so dependent on us and having to come back to us every single time, where they're in total control and confident they can get rid of the disease and help them maintain it.
And it works.
Yeah, it works.
So you can get rid of the no more bleeding gums, bad breath, loose teeth, puffy red gums.
I give you an example. I have a fantastic patient who is a very prominent attorney. She is in tip-top shape. She's always dressed well. She's very sharp and very smart. She's been going to a very well-renowned periodontist for 25 years, and she's been told that she has gum disease, and this is genetic, and there's nothing they can do, and they keep doing the deep cleanings every 2 years. And the truth is, because insurances pay for deep cleanings every 2 years, so they're getting it done. She's just, she's a very, very persistent patient. She comes back, but nothing is happening. Her teeth are continuing to move. She's still continuing to experience bleeding gums. And she got to the point where they told her, that's it. It's the end of the road. You got to have all your teeth out. So this patient, being smart as she is, looks us up and she says, there's got to be an alternative way. I just want to hear about it. I want to know my options.
I'm at the edge of my seat right here waiting to find out what you're doing.
So basically what we do is a non-surgical approach. And this approach involves getting to know the patient, getting to understand what causes their problem before rushing into cutting it off. We do microbial sampling.
What's that?
Microbial sampling is just taking a test of it where a patient really simply swishes and spits into a little cup, and we send it to the laboratory, and it comes back with some information about what kind of bacteria a patient has, how much of each bacteria, and which particular antibiotics work for this bacteria and which ones don't. So I mentioned antibiotics, Randy, and it's not really what we are doing for every single patient. Antibiotics can be sometimes an adjunct in certain situations, but let me tell you what we do besides that, that can help the patient.
So you take this swab of their mouth or spit and send it to the lab. Now you know the exact type of bacteria that they have in their mouth.
Yes.
Okay. Now, and then what do you do?
So once we know what kind of bacteria they have, we get to know the patient. We want to know everything about them. We want to know if they have anyone in their family that had gum disease. When did they start experiencing these symptoms? Do they have any children or a spouse that has gum disease? Do they take their children to the dentist? Has the dentist said anything about that? So we want to know everything about them, including them owning pets, because pets can be a source of parasites. And the reason we get to know them, Randy, is because we may have to change their lifestyle or help them change their lifestyle so this disease is completely eradicated and doesn't come back.
Okay, good. So you sent out the lab work. Now what?
So the patient comes back,
And what are you looking at? Like, what does this show you?
So great question. And when we get a lab report from the laboratory, it's a very simple way to understand what this patient has, what bacteria this patient has, what is like how much of each bacteria this patient has, and how difficult or easy it is to treat these bacteria.
Okay.
Once we know, we kind of have an idea how long is this going to take, how persistent do we have to be, and we can communicate all of these things to our patients. So once the lab work comes back, we discuss everything, we explain to the patient, and we set them up with a series of meetings in our office where they will come back and we will look at a sample of their bacteria every month under the microscope. And it's a great tool because it's not something that we dentists just tell them they have. They get to look at it with us under the microscope. We show them, look, this is what you have today. This is where we took it from. This is what you have.
So under the microscope, like you could actually see the bugs in their mouth?
Yeah, absolutely. We see bugs and we see parasites in their mouth. And of course, we can't see viruses, but viruses are also involved in these types of situations. Okay. And it's really important to understand this. I hope I can talk to you a little bit about some of the things that these viruses, bacteria, and parasites can affect other systemic
because
problems.
They leak into your system.
They do. And remember that bleeding we talked about and puffy gums?
Okay.
So every time you're flossing and it's bleeding, that bacteria that sits in there gets into your bloodstream and makes its way to other organs in our body.
I won't mention the titles, but the #1 book on heart disease right now has a chapter on getting rid of this bacterial infection in your mouth. The #1 book worldwide on reversing Alzheimer's also says, get rid of the gum disease.
Right.
It's like another thing that the immune system has to worry about. So how do you kill these bad bugs, this bacterial infection? That's the part I want to know.
So what we do is once we identify which bacteria at that visit the patient has, we know how to properly address them with topical creams and routines with rinses, with certain things. They're pretty easy things to do, very generic, so even a child could do that at home. We just guide our patients and we make a program for them to what they should be doing for the next month at home. And once they come back the next month for the similar type of visit, we again take a look at this bacteria.
Like a before and after comparative blood work study?
We look at what is
saliva?
there today. And the best part is that at 2 months, 99% of patients experience a major change. So they will come back and they will tell us, look, I've noticed my gums are not bleeding anymore. I've noticed that I don't have as bad, my husband, you know, we had problems with intimacy. I mean, I'm sorry to say that, but a lot of these patients say that their spouse doesn't want to kiss them or doesn't want to be intimate with them because of the bad breath, because of the bleeding that occurs, and they just taste something different. And it's a big problem for a lot of people. You know, they say that, you know, for the first time, I didn't experience that. I was able to be intimate with my spouse. They will say that, you know, my grandchild who kept telling me, Grandma, I don't want to, you know, be next to you. Now all of a sudden says, Grandma, I don't feel that smell that came from your mouth.
Because of these protocols you're using in the office to kill this bacterial infection.
Correct. And most patients...
And at home too?
Yeah, they continue to, and this is what makes this so beautiful. This is not something we do at home and make the patient completely helpless. You know, it's not something we only do in the office. They go home and they're in full control. They know exactly what to do with very simple protocols such as creams and rinses that they can get rid of this disease at home.
Now, if it's as good as you say, why doesn't every periodontist, why are they right now these expensive pocket reduction procedures where they're cutting out the diseased tissue, leaving sometimes people with cold sensitivity, things like that. Why are they doing it that way? Are they ignoring this way? Is this more of a hassle? Is it less money?
Randy, I ask myself this question every day, but really mainly it's because they just don't know about these types of treatment.
So it's that effective. Would you stack it up against the results from that surgery? Because the surgery is meant to get rid of the bacterial infection. So does this, with your topicals, your rinses, and in certain cases targeted antibiotic therapy, is it just as good as these other things?
I think it's a lot better because
better.
you don't experience all the symptoms and side effects of these surgeries. So these patients very gradually get these results and they don't experience the negative side effects. Plus, this is a much less expensive treatment when it comes to, comparing to surgical. I'm sorry to say, but that's one of the reasons that some periodontists don't do it.
You call it the Bonner method.
Yeah. It's
Is
called the
that-
Bonner
and
method.
how-
Dr. Bonner is a Canadian doctor who actually developed this method and has been trying to teach dentists about it for a while. But unfortunately, in today's society, we're just used to kind of dealing with things very quickly and eradicating them with surgery. And not a lot of dentists listen to that.
Okay.
Now, when I heard that, I knew that we were definitely onto something. And the results we've been getting with patients, I mean, it's a no-brainer. It's the way to go. It's the way of the future.
Could it stay away for a long time?
It will
This gum
stay
disease?
forever.
Because some people, doing some of the research, once they've been given that diagnosis of gum disease, it's like every 3 months they're in for a deep cleaning of some sort, loaded up with tons of antibiotics, which is another topic which could be bad for the system.
Of course.
You're saying that you could eliminate most of that
Yeah.
and give them healthy teeth and gums.
Absolutely. We can be totally successful if we eliminate the infection. We're able to teach our patient how to maintain it. We can keep this disease away from them.
Are there patients that have been told elsewhere these teeth have to be extracted, either by their general dentist, their periodontist? We have to remove these teeth, where you were able to save them.
Absolutely.
And if
And
so,
I'll
why
give you
or
a
how?
great example of that. We had a very sad story, and this is a real story, of a 14-year-old girl that was referred to the office for full mouth extraction. She came in with her grandmother because that's who was raising her, and they were both crying in the chair saying, like, I can't lose my teeth at 14 years of age. What am I going to do? What are my friends going to say? I mean, the only option for me is dentures, because at 14, they're too young to have dental implants placed.
Okay.
And they will not be ready for that at least until early into their 20s. So for this particular patient, there's no other way. We cannot do this to her.
So because she had this infection all around her mouth,
She had it around all her teeth.
did you, in your mind, when you're doing the consult, going, I think this is going to work? Or were you also skeptical?
We knew that this is going to work because the first question I asked was, does anyone in your household have gum disease? And she turned like this, looking at her grandmother, and she said, yes, I've lost, all my teeth due to gum disease. I said, how long have you guys been living together? I mean, they're sharing utensils. They're doing normal things like a family. They're kissing each other. They shared a cup of juice or tea together, a spoon. And basically, most likely, this is how she got this disease. It was transmitted from her grandmother to her at a very, very vulnerable age. So the end result with this patient was that we were able to get rid of all of her bleeding. We were able to give her a beautiful smile that she was proud of. And we got her teeth to such a stable condition that she was able to get orthodontics and straighten them.
Well, that's nice.
Yeah, and we followed this patient for about 10 years. She was, I believe, 11 years actually. She was about 25 years old and she still had all her teeth in.
So there's a lot of patients like that are watching this that have really bad teeth. Maybe they were told, like the girl, all of these have to be removed. You might be able to save their teeth with this protocol.
Absolutely.
You believe
and we
that?
do this on a daily basis.
Are there millions of people that could benefit from this?
Yes, absolutely. There's about 80% of people that are over the age of 65 and 50% over the age of 30 that have at least one tooth with this gum infection.
So if a periodontist is listening to this, hearing this right now, and they love surgery, I had a periodontist that said, that's trying to use other methods. He says, well, we're trained. We love surgery. So if they're sitting right here where I am hearing this, and they're skeptical, they're saying, I don't know, with some of the severe cases I'm seeing, I don't believe her protocol would work. What do you say to them?
Well, I love surgery too. I'm a surgeon. I wanted to be a surgeon from the time I remember myself. I was 4 years old. But to be honest with you, again, not every single patient is treated with the same tool. We approach every patient on a custom tailored basis. So we approach this in the least invasive, least expensive way because this procedure is about half the cost of a surgery, and it doesn't cause any discomfort or
So no
create any
downtime.
problem. No downtime at all.
How soon does the breath get better? And how soon does the puffiness go away?
We usually see the improvement within first and second visit. Most patients, by the second visit, they tell us that everything, all the symptoms have gone away, and now it's just a matter of maintaining things and getting to the bottom of it.
Is this the future of dentistry? In your opinion, if 40 million people are losing their teeth, or 30 million from this bacterial infection, you say it could be wiped out with protocols like this.
Absolutely, Randy, and we've been doing this in medicine already. I feel like dentistry is a little bit behind medicine. You know, we now are most patients know that not every single problem has a solution with surgery in medicine. You know, we're treating a lot of patients in gastroenterology, in gynecology, in dermatology. We're basically treating patients all the time with non-surgical, non-invasive methods, and we're getting better results. Well, we finally caught on to this in dentistry, and this is the way to do it.
So at the top of the show, I said no more bleeding gums, bad breath, loose teeth. You believe that's true? If caught early, it's even better? Probably.
The earlier, the easier to treat, the easier it is for the patient, but of course we treat all stages of gum disease.
So if you're bleeding gums, if you can catch people early when they're just starting to bleed in the flossing.
Yes. If you can
Easy.
just catch
It's
it
easy for
early,
you?
it's super fast and it's super easy, not only for us, but for the patient.
Now we're short on time.
Now, I want to mention one little
Okay.
thing before we end this, that I think
About
is
a minute
really,
left.
really important. It's self-confidence. It's the self-confidence that these patients are able to gain. They're able to finally smile. They're able to go and enjoy their food, their cold beer, their ice cream with their family. They're able to smile at the job interview. They're
Nice.
able to smile on photos. They're able to be confident. And we know today that self-confidence is what it's all about. It's not what's happening with you, it's how you feel about yourself
Good.
that really makes the difference.
So if a patient's watching this and their general dentist told them you need a deep cleaning, that means you have a bacterial infection under the gum line. Is that your ideal patient? Catching them early?
Yes, absolutely. Our ideal patient is at any stage, but the sooner we can catch this, the easier we can help our patients.
Now, Medicare, Medicaid doesn't really cover this. Even the best dental insurance covers a small portion. But you say people finance this.
People finance this all the time, and let me tell you, Randy, it's a lot less expensive to keep your teeth than it is to get dental implants.
Good. I want to thank you for coming on the show. Good stuff.
Thank you so much, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.